So again, this is for Boyce 130 dosage calc review. You guys have your test next week. Test is similar format as your 110 test. You'll have 25 questions. You can miss two. The majority of the questions are similar or the same kind of content that you had last semester, where you're going to have your conversions, so metric to metric, household to metric, pounds to kilograms. You're going to have a input or intake question where they're going to give you the different foods and liquids that a patient's receiving, and you have to convert it into milliliters. Um, and so you'll see that question again. You'll see oral-based meds, which usually most students are not having issues with those. That's where you're calculating for how many capsules, how many tablets, or how many milliliters if it's a oral suspension to administer to the patient. For the parenteral medications, you're going to treat those just like you would treat an oral-based suspension. You're calculating milliliters, right? You can only inject liquid into your patients. So that's your kind of clue, because I know when you guys get your questions, it doesn't necessarily explicitly say what you're looking for. That's why I kind of give you that clue. You'll do some insulin dosage mixing. That's usually pretty straightforward. Remember, insulin is units. So that's like your only liquid that's not ml. Insulin is measured in units. The thing that's new for you guys this semester that wasn't on the 110 test, but you may have had experience with it with ATI, is the flow rate calculation. So that's where I'll start and kind of work through here in just a little bit. You'll revisit reconstitution, and then you'll have some complex dosage calc problems, which just means that there's two steps to solve it. Meaning, typically, you're going to take the patient's weight in pounds, convert it to kilograms, and then solve for the milligrams or the milliliters or the tablets, depending on how that's all set up. So let's go ahead and take a look at the review. So uh I always tell the boy students, like, I don't have I don't have access. If you guys get like a practice set, I don't have access to that. I'm always open to receiving it. If you do receive something, you can even drop it into the chat if you have something, because then that way it's something specific. If you have nothing, then at least I'm giving you something. This was actually most of these questions were set up by I think she's practicing nurse now, um, that had gone through for 230, the 230 test, and she put together a whole bunch of practice questions that were very similar to the types of questions, not exactly identical, but very similar to the types of questions that you might see on your test. And so I always say, like, make sure you can always kind of build up questions from there. The 5 questions just tells you like how many questions to expect of that type. And sometimes there's overlap. So like I said, I'm going to focus on the flow rate and then the complex. And then we can come back and review anything else um, that you might want to have a reference to. So I'm just going to scroll through. Hopefully you remember the things you have to know, right? You have to know all your conversions. They're not going to be given to you. So spend a little while, make sure you review your conversions. And then if you have any questions, we can certainly go through those. But let me pull up the flow rate questions, because like I said, those are the ones that are new, and you're going to want to you may not have a strong sense of how to calculate them. So give me 1 second, because I got to find one. Okay, so we're gonna go with these two here. All right. So in this question, before we get started, there's a couple things you need to know. You need to know that when we talk about flow rate just means that there is some sort of volume over some sort of time. Usually, usually it's milliliters per hour. And I apologize, I'm writing on on an angle here, but just because I wanted to save some room. Usually, when you're calculating a flow rate, it's milliliters per hour. So the next time you're doing your clinical rounds and you see the infusion pump, like just pay attention that it's infusing and it typically says milliliters per hour. Um, and then unless they're using like some sort of drop, and then that would be a different unit of measurement. But I'm gonna come back to talking about drops in just a second. But flow rate is specifically volume over time, and then what you're looking for is milliliters per hour, typically. So when I see something like the patients to receive 400 milliliters of RL, which stands for Ringer's lactate, over 5 hours. Believe it or not, this is a commonly missed question because most nursing students, you're so you have such anxiety about taking this test that you start to like not realize that this is more straightforward and simple than you're giving yourself credit for. And like I said, if it says what would you set the rate? Rate tells you it's something over time, right? The rate of speed is, miles per hour. For the rate of infusion, it's milliliters per hour. So all I'm going to do is I'm going to take 400 milliliters, I'm going to put it over the 5 hours, and then I'm going to reduce the 400 over 5. So you take out your calculator, unless you're really good at doing this in your head, 400 divided by 5, and you would set the infusion to 80 ml per hour. So you don't need to calculate per minute. You don't need to make any other conversions. You're not going to have to worry about like doing anything with ounces or cups or or even solving for how many, milliliters to administer. You just want to know what you're programming into the pump so that the patient's going to receive that 400 milliliters over a 5 hour time frame. Now, one of the things I talked about with my other class, with the Allegheny 130 class, is I told them that sometimes the ml per hour doesn't seem to make sense because it might seem like it's greater than what you're actually going to be giving them. Meaning, like, let's say you're only supposed to give them like 30 milliliters in like 20 minutes, but they're still asking you to calculate a flow rate in milliliters per hour. Your number is going to be higher than 30, but you're going to run out of the product before within that in that 20-minute time frame. It's a bad example, but and like I always say, this is kind of like the um what you expect to see, or this is just in the math bubble of things, so don't get hung up on why this doesn't look right from a clinical perspective. That's not how this is supposed to be done. This is just based off of the math and making sure you know how to set these things up. So we're in the math bubble, so don't get hung up on if it doesn't make sense entirely. So for those of you who are here live, the next question says that the patients to receive 200 milliliters of Ringer lactate over 1.5 hours. I want to know, and just type it into the chat. What would you get as your flow rate for that question? And I'll just give you like a minute or two to do that. And if you don't know, you can send a private message or direct message and just say like no clue, question mark. That's perfectly fine. This is the place where I want to know what you know and what you don't know. The other thing is, and I think you guys are starting to put in the correct answer here, and I want you to know that you probably won't have a question where it's going to be like, do I round it up, like round it to the thing, like where do I put my like rounding? Yeah. So first of all, everyone's doing it right. That's what we would see here. And then I'm going to answer your question in just a second, Alexa, because there's a nuance to that. So the 1.5, you're setting that up. You're getting the 133, and then it's 0.333, 3 repeating. So from what I understand, based off of rounding rules, and this is something you would want to confirm with your lab instructor, whomever is grading the test. Like I said, I don't think you're gonna. I think you're gonna get an answer that looks more like this, where you don't have to worry about any kind of rounding. But from what I understand, when we deal with volumes, we can round to the nearest tenth. So if I'm answering this question, if I were to get this question without without first like uh confirming with my instructor, I would say 133.3 ml per hour is what I would write. However, saying that, most likely you're not going to get an answer or a question that's going to have like a decimal for the flow rate. It's usually pretty straightforward. The challenge is just knowing what to do with the numbers. Okay. Um, but everyone did that well. So good job. Okay. So, um, So flow rate typically is volume over time. The next thing they're going to do with the flow rate is they're going to ask you to use the information from the flow rate to calculate other pieces of information. So like in this example, it tells you that you have an IV running at a certain infusion rate, and it wants to know how long that infusion will be running for in hours and minutes. Okay. So the next thing is they want you to be able to utilize, if they give you the flow rate, what does that mean? So think of it this way. If I need to travel 250 miles and I'm traveling at 100 miles per hour, I think a lot of times people are like, "Oh, okay, I get what that is. If I'm traveling 100 miles per hour and I'm trying to get to 250 miles, that's going to take me about 2.5 hours." Okay. And then if I'm only going 50 miles per hour, or if I'm going, 200 miles per hour, like all those things, like kind of help to kind of to put it in that perspective. So what's in your IV is kind of like your distance, your miles, and then the time or the speed that you're going is what the infusion rate is. So, but as always, if you ever get stuck, here's what I recommend doing. Start off with your volume in your IV. So that's 250 milliliters. So as you see, 250 milliliters is the dextrose 5% water, and it's running at 100 milliliters per hour. And the question is asking how many hours, how many minutes is this running for? So I'm going to create a conversion factor where I'm going to get rid of milliliters in exchange for the time. So this is really important. So you're not guessing at this. You're going to be dividing by your infusion rate. Okay. And then what you get is 2.5 hours, which is the same thing as 2 hours and 30 minutes. Now, sometimes you might get something that's like, what if you got an answer that was like, 1.15 hours? So there's a couple of things that you could make this. Actually, I meant to say 1.25. So 1.25 hours, 2.25 is the same thing as a quarter of an hour. So that would be the same thing as saying 1 hour and 15 minutes. So this is just like an extra example. If you get like a 1.25, or even if you got the 1.15, what do you do with that decimal? And if you ever get stuck with this, what you can do is if you just take, um, let me just double check my calculation before I tell you something wrong. Yeah. If you take the decimal that's there, so that 0.25, if you multiply it by 60, that'll give you how many minutes that is. So 0.25 times 60 is 15, and that would be 15 minutes. So if you ever get stuck with like a decimal answer for a question like this and you have to be specific, just multiply the decimal by 60 and that'll give you the time in minutes. I don't think you'll have to worry about it. I think it'll always end up like 2 hours, 2.5 hours. It'll be something very specific. Or if you already know 0.25 and 0.75 or 15 and 45 minutes, then you'll be fine as far as that's concerned. So I think I have a separate example. Oh no, I don't. Okay, that's all right. Um, so this is one of those questions that I was talking about, like where, or that you might have to manipulate time a little bit. So like for this question, it gives you the flow or it gives you the time in minutes, but remember it's asking you the flow rate. And if we're asking for flow rate, even if it doesn't tell you the units that you're looking for, it's going to be milliliters per hour. That's kind of like the standard for your infusion rates. So the way you can do this is by taking your 240 milliliters over your time and then converting your minutes to hours. So um, you might already know that, 40 minutes, what that is a decimal or whatever that is, but um, you don't have to do that. um, just make sure you're converting so that you're left with milliliters per hour before you answer your question. And then you just plug that into your calculator. 240 times 60 divided by 40, and we're going to get 360 mil per hour. Now, this is where I had a student ask me yesterday, is like, well, what about like 360 milliliters per hour, but they only are supposed to be receiving 240 milliliters? Well, that is still correct. After 40 minutes, the 240 milliliters of Ensure that they've been ordered will be gone. Okay. So that's how you interpret that. If I had more Ensure there and it kept running, then they would get that extra 120 after the next 20 minutes passed. But um, that I just want you to be able to see that information and know that that is what it's supposed to be. I don't think you're going to see it like it's not going to be convoluted. I think it'll be very straightforward. They just want to make sure you can convert hours to minutes and that you don't divide by 60 when you're supposed to multiply by 60 because that'll give you the wrong answer. Um, okay. So the next type of flow rate question is dealing with a drop factor. Now you should be given the drop factor. If you're not given the drop factor, then there's a couple things that we'll need to know, and I'm gonna indicate that in just a second. But before I talk about drop factor, um, or the drop rate, let's talk about what that is. So drop rate is just another type of flow rate. Remember, flow rate in general is just volume over time. So what we're doing is we're just converting one flow rate, which is milliliters per hour. So milliliters per hour to another flow rate, drops per minute. Okay. So there is a formula that you can follow that says you take your original flow rate, which is usually ml per hour, but it could be ml per minute. So either one of those. But you take your flow rate and you multiply it by your drop factor. The drop factor is going to be in drops per milliliter. Those two pieces of information will give you your drop rate. And your drop rate is going to be written as drops per minute. So this is TT. I know it looks like I'm writing a funky H, but that's supposed to be TT. So the abbreviation for drops is GTT. Now your drop factor is typically given to you. So like I have it highlighted here. The drop factor in this particular example is 10. If there is no drop factor given, but they tell you it's microtubing, microtubing has a drop factor of 60 drops per milliliter. So just in case you see that, that seems to be a standard. If you look up microtubing, you'll see it. But we can't assume that all the tubing is the same because the diameter of each tubing is different. So there's 10, 15, 20, 25, 30, 35, 40, 45, 50, 55, 60 as far as drops per milliliter. So it's important either to know what it is. The other thing is, like in this question, you'll see how it says, what is the infusion rate? So that might be a little bit confusing if you're sitting there going like, well, we just discussed just a few minutes ago that infusion rate is milliliters per hour. You are right. However, if they give you the drop factor, most likely they are wondering, they want you to be more specific and giving the drop rate, not just the milliliters per hour. Okay. So just so you know, when you're kind of looking at that, if you are ever stuck, that's kind of like the short answer of it is they're looking for the drop rate. So this question also has some extra information that is not needed to solve. And I intentionally put that in there because you're probably going to see it on your test. And I want you to be able to know when to kind of filter out the information you don't need. So the only time we really need to know how much is in the IV is if it tells me like I have an IV of 500 that's infusing over 2 hours, then I need to know what the total is. I also need to know if I'm calculating how long an infusion is going to run for. So like in that previous question where it was running at, or we had a 250 ml IV that was running at 100 mil per hour. I need to know what the total is in that regard. When I'm making a conversion from flow rate to flow rate, I really don't need to know what the total IV is if I already know the flow rate. And what I mean by that is once I can see I already have a flow rate listed here. I have 210 milliliters per hour, and I have a drop factor. And as I mentioned before, the only thing you need to solve drop rate questions is the flow rate and the drop factor. So I don't need to worry about how much of the IV is there. That's not the question being asked. All I want to know is my current drop rate is 210 milliliters per hour, but I want to know what that would be in drops per minute if I had to change something or if I was setting that up or I was trying to make that calculation. To be honest with you, I don't know why we do this necessarily. I just know that you are supposed to know how to do it. So, all right. So 210 milliliters per hour. So I'm going to show you the long way first. And I want to show you the long way first because this is the way that's commonly missed. Most students, when they're first going through this, will set it up because they said, Dr. Rad said, flow rate times drop factor will give me my answer. And what you're going to get if you leave this as it is, you're going to get 210 times 10, and you're going to get 2100. And then you're going to say, oh, yeah, and then I'm looking for drops per minute. And you're going to incorrectly put drops per minute, even though you're in drops per hour. So this is why it's important to set up your problems, at least in the beginning, to make sure you're in the correct units before you kind of do anything. So this would be incorrect, especially if you put this as drops per minute. We have to convert this to minutes. And you know that 1 hour is 60 minutes. So if I take that 2100 divided by 60, I'm going to get 35 drops per minute. Now, the way that I kind of circumvent this kind of headache here, and so I never have to worry about it, if I'm looking for minutes, and hours to minutes is a very easy conversion. Most of you can just do it in your head, even if it's like 2 hours or 3 hours, or you can easily plug it into your calculator. What I'm going to do is, before I write anything down, I'm going to actually just convert hours to minutes right off the bat. Okay. So 210 milliliters, 60 minutes times my drop factor, which is 10. And before I do anything, before I even take out my calculator, I can already see that I'm in drops per minute. I'm in the units I want to be in, and I just plug it in the calculator, 210 times 10 divided by 60, and then I get 35 drops per minute. So try this one. I'm going to try and zoom in a little bit here just so you can kind of see it a little bit better. Hopefully that's a little bit easier for you. So go ahead and try this one and let me know what you get for your drop rate. And when you have an answer, just go ahead and drop it into the chat. Take your time. All right. Well, looks like I am unable to trick at least Alice and Hannah. Is anyone stuck? Is anyone not getting 75 drops per minute? All right. Just in case. Okay, good. Let me guess, you did something with that 200 milligrams. So this is a good example of a type of question that has extra information. So I even gave that to you in the previous scenario. It's just that we just changed what the information is. So Solu-Medrol 200 milligram IV, very important, making sure that the patient's receiving the correct medication. But it doesn't help me with the flow rate. Okay. So it's just another piece of information. So I always say it's like, it's a Toyota, Camry versus a Honda Accord. Um, it doesn't matter. They're both going the same speed and they're both gonna, we're just basically making that conversion from miles per hour to kilometers per hour. It doesn't matter what the vehicle is. Okay. So we don't care about that. I care about the volume and I care about the time and I care about the drop factor. So any of you that got stuck, hopefully you didn't convert that to hours because you don't need to. Because remember, if they give you a drop factor, they're looking for the drop rate. You should get 75 drops per minute. What about oh, go ahead. Oh, good question. Yes, Alice. Yes. So drops, you can't give someone a partial drop. They get they either get the drop or they don't get the drop. So you would round to the nearest whole drop. So if you do get an answer that's like, 24.6, then you would round it to 25. If you got like, you know, I don't think you'll have to worry about that in your answers, but if you do get a decimal answer, round to the nearest whole drop. Um, Go ahead and try the gentamicin question, the first one here. Let me know what you guys get. Please, I love questions. So if you were to, um, you would just be doing an extra step. So if because ultimately we're with if the drop factor is present, we know that we're looking for drops per minute. So if you were to multiply by 60, divide by 50, convert that to ml per hour, then you're gonna just have to divide by 60 again. So you're going in a circle because you still want it in minutes as your final answer. So if it's already in minutes, then leave it in minutes. Don't convert that to um don't convert it to milliliters per hour and then back to milliliters per minute. You don't need to do that. You're just doing an extra step. Good. Yeah, you're welcome. Good question. All right, so what do you guys get for the gentamicin question? This is intentionally tricky. So this was an example where you would do some rounding. So I'm seeing the answers. So you should get 21 drops per minute. So let me just explain this one real quick, just because sometimes I actually put two pieces of information in this question that are not necessary. So I think I'm not tricking you anymore about the 75 milligrams. I think we're okay with that. What's a little bit tricky is you have volume over time, and then there's this other time. Okay. But if I had said, you know, what is that? Uh, what is it? If I had said, excuse me, if I had written out like QID for, 4 times a day, I think that's right. It's been a while since I've done that. You wouldn't have done anything with that. You would have been like, oh, okay. But when we add that every 6 hours, all that's telling you to do is to run this medication for 35 minutes every 6 hours. So every 6 hours, you're going to rerun this medication. Okay. But when we're trying to figure out what the drop rate is, we don't need to worry about the every 6 hours. That's just telling you when to repeat your procedure. So 150 ml, 35 minutes. Because there's a drop factor, you don't need to worry about, don't convert minutes to hours, just leave it alone and just multiply by 5. Now, sometimes they will just give you the drop factor and not give you the units. So it's helpful to remember that the drop factor is indeed drops per milliliter, just in case you see that. And then you do get like 21.46 something, something, something. And we would just round that to 21. In reality, you might only be able to set the drop rate to 20 or 25 or 15. So I don't know those specs. So for purposes of this, just focus on doing the rounding to the nearest whole number. So this is just another example. So this is also in, if you've gone into the shared OneDrive folder, or and if you haven't, please email me. I'll make sure you have access to that. But if you go into the shared OneDrive folder, you can have these practice questions if you don't already have them. Okay, the next thing I wanted to talk about was the the two-step problem. So I have two examples. So we'll go through one and then I'll have you try out the other one and then we'll kind of go from there. So you're going to see this a lot more next semester when you go into 230 and you're doing pediatric dosage calc. The other thing you're going to see next semester is they're going to ask you to calculate something called a heparin drip rate. And instinctively, you're going to think, oh, drip rate, drop rate, drops per minute. But the heparin drip is just in milliliters per hour. It's just, a lower, it's like 5 mil per hour, 10 mil per hour. It's really like kind of a slow drip. Um, and the clue will be there's no drop factor listed, so you don't need to worry about it. I'm just giving you a heads up for something to pay attention to next semester. But you won't have to worry about it this semester. All right. So it says the doctor writes an order for ibuprofen, 2.5 milligrams per kilogram by mouth every 6 hours for pain for a child. Child weighs 68 pounds and it's available in 35 milligram per 2 ml. And then it wants to know how many ml will you administer. So again, this is basically just it's considered a two-step problem because you need to convert and account for the patient's weight. You'll find that a lot with pediatric based dosages. And then you're just going to solve for ml like you've always done for um, your um, your calculations for your oral based meds. So I'm going to take the patient's weight in pounds and I'm going to divide by 2.2 to get that into kilograms. Now, I typically take that number and I round it to the nearest tenth, and I'm going to show you that whether you do or don't, it should still work out. But again, this is one of those ones that you want to confirm with your instructor. So the actual answer for um for this is 30.909090 repeating. So I just rounded it to the nearest tenth. That should be fine. But again, if your instructor doesn't want you to round until the end, make sure you get some clarification on that. And I'll show you what that would look like and how I would set that up. Um, just so um just so we're all on the same page and you know how to do it if it's a sticking point for you. But I'm going to take that number and multiply by the 2.5 milligrams per kilogram. And what that's going to do is eliminate kilograms, and then I'll just have milligrams left, and then I can do ordered over available and be done with the problem. So 30.9, nope, that's not what I want to do. 30.9 times 2.5, I'm going to get 77.25 milligrams. And then I can just do order over available. So my order is to 77.25 milligrams. I'm going to put that over the 35 milligrams times my quantity of 2 ml. So times 2 divided by 35. And I'm going to get an answer again where I'm going to have to round. It's like 4.4142. And I'm just going to do 4.4 ml. If I was doing this where I was concerned about the rounding, I would take my 68 pounds divided by the 2.2, and that's my pound kilograms. I'm not gonna, well, I might as well represent this the right way. I'm gonna take the 68 pounds times the 2.2 pounds per kilogram, and then I would just put in my next conversion, which would be the 2.5 milligrams per kilogram. And so what I'm trying to do is eliminate the things. So I'm left with just the milligrams. And then I would convert the milligrams to ml. So I'm going to come down here. I'm sorry about this. Um, this would be the 2 ml. and then the 35 milligrams. And if I set that up where I save my rounding to the very end, you're going to get, so 68 divided by 2.2 times 2.5 times 2 divided by 35. You're going to get a rounded answer to 4.4. So I just wanted to show you that whether you do your rounding here, um, initially when you convert pounds to kilograms, round to the nearest tenth, or if you wait and do it at the end, it still should end up being about the same um, final answer. Okay. But again, you can ask your instructor and just get confirmation if that's something that you are worried about. Um, Go ahead and try the next one. I just want to make sure you got it, and then and then I'll ask if there's any other questions. For those of you who got 3.9, did you round the 73 divided by 2.2 and then solve, or I just want to see. I'm going to try and do that the same thing. Yeah, so if you're getting like 3.984, um, yeah, okay, so 3.972, you're getting those like big numbers. So when you get that number, like, because remember, when you're rounding your 10th place, you have to look at the hundredths place. So if it's six or greater, or I'm sorry, five or greater, then you're going to round that up. So I would give an answer of 4 milliliters. So what I'm saying is, if you got like that so I got, with rounding the 73 pounds, I got 3.984. And then when I rounded it to the nearest tenth. And so I have to look at that eight to tell me what to do with the nine. And so since I'm following rounding rules, this is actually going to round up. So I would say that my answer is 4 milliliters. And you might be like getting like stressed out about this. What's the difference between 3.9 and 4 milliliters? It's a tenth of a milliliter. It should be relatively insignificant. This, and at least in regards to like something like ibuprofen, something like heparin, yeah, maybe that's a bigger deal. Um, but obviously, anytime there's a discrepancy, and like I said, you'll dive into this next semester in pediatrics, and you'll be like, hold the medication, call the doctor, and confirm that you're administering something safely. And like I said, you're going to talk about that more in 230. So right now you don't need to worry about it. Okay. So those are the main things that are like new and different. Do you guys have anything that you want to look at before we close up? or any type of question, I should say. Yep. I would agree with that, Alexa, is that the thing that's going to help you guys out the most is just practice. Okay. Practice setting up your problems. You really don't need new or different problems or a whole bunch of different varieties of problems. You just need to make sure you know how to set these up. If you set it up 3 times and you miss it 1 out of 3 times, make sure you know what mistake you're making and then double check your work. And if you're running into something where, like, let's say you try something 3 times and you get 3 different answers, that's a great thing to email me about so I can give you some correction or at least how to set it up. But if you're going through these your practice sets and you are able to answer all these questions, you know how to work with the reconstitution, you should be good to go. And like I said, I'll be meeting with Boyce 130 again this afternoon. I think I said 5. Um, yeah, 5 o'clock. So if you want to jump on again later, or if you have any other questions, please feel free to email me. If I don't hear from you, I wish you the best of luck. I hope you guys crush it. And like, yeah, like I said, good luck. Yeah, you're welcome. Thanks for coming.